Great. Welcome back to House Healthcare. We are sticking with S37, but we are switching to sections 3, 4, and 5, which deal with insurance. And so we have Blue Cross Blue Shield, representative for MVP, and Diva here with us. So Sarah's going to start. I'm just looking for the right page. Section 3.
Page 6.
Starts on 6. Yes, thank you.
Sure. Great. Thank you for having me. Sarah Teachout. I'm Director of Government Relations for Blue Cross and Blue Shield of Vermont. And I would, like to start out by saying that we strongly support this bill. We believe that Vermonters should have access to abortion and gender-affirming care. It is covered in all of our plans. So just to give you I can't remember if I spoke on these subjects in here before, but just so you know, when the Dobbs decision passed last summer, and a number of states made some legal changes to access to care, we created what we call a travel rider that our self-funded plans can purchase to allow someone who's covered by Blue Cross and Blue Shield of Vermont to travel for a service that is not available in their state of residence. So currently, to give you an example where it might apply, a family here in Vermont may have a child going to college in another state who may want or need to seek any of these services. They can utilize the travel rider to pay for their travel expenses just to get the care. So that's sort of the genesis of some of our interest. A lot of the protections we were seeking are in H89, and those are for insurers and employers who pay for these services and pay for the travel rider. So you asked specifically about the bill, and I will jump in. There's actually a piece in section 1, page 2, and it begins on line 5, and I would just point it out to you that part of the definition of legally protected healthcare activity you have here is the provision, issuance, or use of, or enrollment in insurance or other healthcare coverage for reproductive healthcare services or gender-affirming care. So this is a very important section.
Wait, so I'm sorry, where are you again?
I'm on page 2, starting on line 5, and it's
Okay.
C.
Yes, thank you.
So this is the piece that protects the payer, and I'll be broad in my term of payer, but also the people, using their health insurance to pay for these services. Then you asked about.
You're okay with that language?
Yes.
Okay.
I think it looks great. We worked pretty hard, and I know that Legislative Council worked hard on making language. So I appreciate it. Then you have on page 6, section 3. This is the coverage for gender-affirming healthcare services. So we are in support of this. What it does is it pulls into statute protections that are already in the essential health benefits and in Department of Financial Regulation rules. I just wanted to note that Blue Cross and Blue Shield of Vermont began covering gender-affirming care in 2012. It was added to the essential health benefits in 2014. So we have done this without a mandate or a rule. We were already covering these services.
So can I ask you a quick question on that? Because it came up yesterday. Since you are already covering it, we would not expect to see a premium increase specific to this legislation.
No, and I worked with the Senate to ask that this didn't expand the coverage or make different definitions, especially gender-affirming care is an evolving area of care. And so we want the statute to not be so specific that we can't change it as healthcare services change. Okay. And I do know that you wanted to add prescriptions, and that's totally fine.
Okay.
We cover prescriptions if they're part of the care.
Okay. Do you mind questions?
No, I don't.
Okay, Mari, and then Art.
It just slipped out of my head, but thank you for addressing the medication issue, because you probably already do that.
We already do it. Yeah.
Because it's accepted standard of care.
Yes.
Okay, I remember. I know in 2011 when we were working with, it was DFR then, right? Not Bishka. Whoever we were working with then. I was involved in that conversation about making sure that it wasn't just people that are transgender have health insurance, it was that health insurance would cover their specific care. And there were questions about how many individuals would that include? And I know we've had conversations in here about there's a broad range of services, including maybe just counseling that people seeking gender affirming care would need. But do you have any data you can share with our committee about including comparing years like 2011 and then 2022 of how many individuals are that you're aware of in your work are utilizing these services?
I can certainly ask. I have seen some data. Again, you hit upon it. Gender affirming care especially can cover a lot of services. And, we may not know, especially if someone's just going to their mental health provider.
Yeah.
If it's for gender affirming care or any other care. So I can see, for some things, it's easier to identify. So I can ask for sure.
That'd be great, because I think what I'm getting at is when we were discussing this in 2011, there was not a significant impact in other states that did this, like people rushing to get gender affirming care. It was a pretty small percentage-wise proportion of the population.
Yeah, I think it still is. And we don't anticipate any impact from what you have here because this is already covered under current essential health benefits.
Okay. Thank you.
All right.
Just to follow up with that, are there any gender affirming care things that you don't cover? I mean, this includes surgery and all that?
It does.
So you cover all of it? Okay. And the other thing, and maybe Lori, you're a better person to ask. We talked about the segment of insurance that we control.
Yes.
Okay, is Sarah, your stuff we control?
I think Sarah can answer that. So we talked about, qualified health plans, individual market, small business, but you talked about self-insured. So maybe you can talk about the whole.
Yeah. So these are both in the state essential health benefits. And we cover them under both our self-funded plans and our fully insured plans.
Must you, or do you choose to?
So it's not just the insurer that chooses, it's the employers. And
right. Okay. I only asked to try to figure it out, not to. Okay, so.
Can you remind us what the essential health benefit plan is, or for new people, what it is? Is that an okay question to ask you? Do you want to?
I'll try. There's others who are better. So that's the state. We have our own state list of essential health benefits that must be covered by your health insurance plan. Last year, the legislature, or maybe 2 years ago, the legislature added hearing aids, for example, to essential health benefits. And so starting this January 1st, hearing aids will be covered under all plans. So it's anything from preventive care and mirrors a lot of what's required federally, but then we have some specific things that are only for Vermont.
And with this, and I'm sorry for co-opting your question, but I just
no.
put some education out there first. So with a self-insured plan, do they also have to follow the essential health benefits? Or can they say to you, well, we want to cover these things, but not these things?
I don't know. Are they required?
Jennifer Carpenter, Legislative Council. Not in the same way that the individual and small group plans are required under the ACA to have the essential health benefits, and the states back in 2012 were given options to a few different choices for how to define their essential health benefit package. Vermont picked as it turned out, Blue Cross Blue Shield plan, small group plan with the largest enrollment in the state, and that whole package of benefits became Vermont's essential health benefit plan. So that applies for individual and small group. For large group and for self-funded, there are certain ACA requirements that apply. For the large group, it has to be substantially similar to, but not identical to. And there's greater variation allowed for the self-funded, but there are certain federally required benefits that have to be included, but not a requirement that it's the same as our essential health benefit plan. Do you have anything to add?
So I can tell you a little bit about how it happens in practice.
Yeah, that'd be great.
I wasn't sure exactly. So we tend to encourage our self-funded employers to cover the essential health benefits that are required by the state of Vermont. They generally cover the ones that were all in effect in 2014. They don't change very often. And so it's big changes that we tend to show them the impact it would be on their premiums and ask about. So for example, the hearing aids was a big new change. So we do ask employers, is this something you want to comply with? Most choose to, because if every other person in the state of Vermont is receiving that benefit, to be the one employer that doesn't offer it is not great for your employees. So most choose to comply.
And I just want to add, I did reach out to DFR after testimony yesterday, and they got back that says the current benchmark includes surgery for gender affirming services. I'll send that email out to everyone. So Art, sorry, back to you.
No, I guess my overarching concern, and it'll always be, is these services, the cost of them, do they get passed on in premiums to everyone?
We treat them like all other healthcare services, yes.
Right. And hence the question that was asked yesterday by Alan. And because they've been in there since 2012, putting this language in, you expect there will be no impact to premiums. Okay. Because they've already been part of the essential health benefits. Okay.
So just the last thing to address in here, you have some changes with cost sharing.
Yes.
So you eliminate cost sharing for abortion. And that we don't expect will have a very substantial impact for two reasons. One is there are not a lot in the state of Vermont, but also you have to have in here the exception for high deductible health plans. And so I went and looked, and 40% of plans purchased through the Affordable Care Act are high deductible.
40%?
40%. So while I just want to say that while we're totally fine with you adding that piece, the impact is going to be negligible.
Right.
Because the people who have high deductible health plans still have to pay out of pocket. So it doesn't, I think, address sometimes the people that you're trying to
address. All right.
So I just want to be clear.
Yep.
Not saying for and against, just
Okay.
eyes wide open in what you're actually doing.
Help a whole lot of people with this. And the cost sharing for gender affirming care, we're not requiring, I mean, we are requiring cost share. So does that affect?
So it's actually how we currently do it.
Yep. Great. All right.
Just that I didn't see that you submitted anything. Is there anything that we could learn from, like retain? Sometimes things.
Sure, I can submit a letter. I think I submitted a letter on the Senate side and asked for changes, and they made them all. So I didn't. I didn't have any changes.
Yeah, just a letter in
Sure,
support.
in support. Happy to do so.
Thank you. Great. Claire. Hello.
Good morning. Good morning.
Is it still morning?
Real quick. So, morning, I'm Claire Buckley from Leonine Public Affairs here in Montpelier, and I'm here on behalf of MVP Healthcare. And thank you for the invitation to testify about S37 and sections 3 and 4 specifically, which you've been discussing related to abortion and gender affirming care. And MVP also does support the Senate passed version of the bill. And we share the commitment to ensure that patients have access to these important services. Currently, as was mentioned, they are covered benefits under fully insured health insurance products sold in Vermont, including by MVP. And But the Senate version made some important changes that to the bill so that we can support it. And you just discussed cost sharing as one of the issues. And, MVP policies sold to Vermont currently cover these services and treatments, but do have cost sharing requirements. And based on the plan that the consumer chose, they could be different for every plan. And so for gender affirming care, we appreciate that Section 3 of the bill would require coverage of medically necessary gender affirming care at no greater cost share than for the diagnosis and treatment of any other physical or mental health condition under the plan. So the Senate maintained the cost sharing, for gender affirming care, and in somewhat recognizing that the treatment are costly and occur over a long range of time. And so we support the approach taken by the Senate, and which protects the ratepayers from added costs at a time when healthcare and health insurance remains unaffordable to so many. And it also recognizes the inequity of selecting any non-preventative coverage and services for preferential treatment over any other medical conditions. And again, on abortion services, as was mentioned earlier in Section 4, the bill would prohibit cost sharing for abortion and abortion-related services, except for high deductible health plans. And that exception reflects, the Federal Internal Revenue Service rules that limit the services that can be covered at no cost before an enrollee's deductible is met. And so by preserving that exemption, the bill as it passed the Senate protects high deductible health plan enrollees from adverse tax liabilities under the IRS rules. So we support that condition. And I would just add that MVP already complies with a no cost share requirement in New York for abortion services. And so we're familiar with that in New York. So notwithstanding our overarching concerns about adding additional cost burden that's shouldered by all the other ratepayers, the cost associated with that change related to abortion is expected to be really low. And so we support that and we're okay with that. And then medical necessity, one of the things in Section 3, it requires coverage for gender affirming healthcare and treatment to be contingent on medical necessity. And the application of medical necessity is obviously an important safeguard to ensure that patients are receiving safe, effective, and high quality care. And MVP's coverage criteria and medical policies closely track the recommendations of the World Professional Association for Transgender Health. And we also, there's a lot in New York State has a lot of requirements as well. But the Vermont Department of Financial Regulation, as was mentioned earlier, also endorsed the importance of medical necessity in an Insurance Bulletin 174. And that's stated, and this is a quote, the application of medical necessity remains an important controlling standard of care and legal requirement for treatment related to gender dysphoria, including transition and health and related health conditions. So we support the Senate including medical necessity in section in the overall bill, Section 3 and 4. And so we urge this committee to, we support the bill and the Senate passed version of the bill. And, I'm happy to answer any questions, but we generally already cover these services, except for the cost share on abortion. But, and as the Senate passed it, we can support the bill.
Great. Thank you, Claire. Art?
Yes, not to make you review what you just said about cost share, but I want to understand it.
Sure.
You said there is not cost sharing with abortion. So that means the person that has the abortion has to pay for the whole thing. Is that what it means?
No, it's the opposite. Cost sharing is like a deductible or a copay or.
Oh, gotcha. Okay.
Okay, so if you prohibit cost sharing, then
There's no copay.
just like if you went to get, say, preventative care today, like if you had your annual physical,
Okay.
those are, at least for kids. I know that you don't pay a cost share on that, like if there's a deductible or, so it's,
Okay.
yeah. And currently.
But it goes towards your deductible if you have that, correct?
Yeah, but
You have an abortion.
well,
Or is it
under this bill, it would be covered and there would be no cost share,
No cost share.
no cost share.
Okay. All right. What was I gonna add? Oh, gender affirming care. Does that continue after, I mean, it can be a lot of things that happen down the line with patients, psychiatric things like that. That all gets covered to the extent it needs to be.
I mean, under the definition, there is a definition of gender affirming care in the bill. And I believe that it covers everything that's covered today and everything that's covered, recommended by all the, and it includes mental health.
All right.
Is one of the things that it would include.
Okay. Thank you.
Any other questions?
This isn't a question. It's not really, we talked about essential health benefits, and Maury sent out on Tuesday to all of us, and I don't know if you got to see it, what the essential health benefits are in the whole process. So just to raise that up again, if anyone needs to see it. And if you need another copy, let me know. Thank you, Maury. Thanks.
Great. Thank you, Claire, very much. Ashley? Hi there.
Hi.
So is DIVA still section 5? Which section is DIVA? Sorry, I'm losing track of all my sections.
Section 4, 5, and 5.
Okay,
Sorry, 3, 4, and 5.
3, 4, and 5. It's still, okay, great. So we're going to turn it over to you.
Okay, thank you. For the record, I'm Ashley Berliner. I'm the Director of Medicaid Policy for the state of Vermont. And today, I think the testimony can be kept pretty short. The Senate addressed all of Medicaid's concerns in their version of the bill. And I can say that Medicaid is already aligned with all of the provisions in this bill that impact the Medicaid program. Medicaid has had criteria for gender affirming surgery since 2008. Its Medicaid coverage policy was codified into rule in 2019 after a prolonged stakeholder engagement process that included community members, providers, mental health professionals, advocacy organizations, and other associations. We provide broad coverage of medically necessary treatment and services for gender dysphoria. The only exclusions to that coverage are for services that have traditionally been considered cosmetic or services that aren't serving a medical purpose. And our policy is consistent with the World Professional Association for Transgender Health, which others have referenced today, WPATH, as a standard of care. Related to the abortion provisions of this bill, Medicaid covers abortions regardless of reason for Medicaid members. Federal funds are prohibited for coverage of abortions for anything outside of instances of rape, incest, or the life of the mother, but we use general fund to provide abortion coverage for any other reason. So federal Medicaid dollars for HIDE allowed abortions, state only dollars for any other reason. And in January of this year, we actually added a new investment under our global commitment waiver that allows anyone, regardless of income or residence, to receive coverage for abortion services under our 1115 waiver, as long as it is allowed under the Hyde Amendment. So only for instances of rape, incest, or life of the mother, as those are all that are federally allowable under our waiver. But we were able to waive the state residency requirement and income requirement using that investment. So just to summarize, our existing coverage of abortion and gender affirming services is consistent with the intent and goals of this legislation.
Great. Thank you, Ashley. I think we have some questions. Art?
Yeah, just to be clear, Ashley, I think I heard you say that general funds are used for abortions. The general fund part of Medicaid is used to fund abortions. Is that correct?
State-only dollars are used to
State-only
fund
dollars.
abortions that aren't authorized with federal funds.
And what are those? What's that distinction?
So Medicaid is prohibited from using federal funds to pay for abortions for any reason other than
Okay.
rape, incest, or life of
So
the
it's
mother.
everything. Okay. And how about gender affirming care? Is that also all only out of our general funds?
No, that is using federal matched dollars. It's a Medicaid covered service.
Okay, thank you.
Any other, Daisy?
Ashley, I'm sorry. Thank you for coming in. I'm sorry, I didn't hear the end of what you said. Medicaid is prohibited to pay for abortions except for in the case of what?
Rape, incest, and life of the mother.
Life of mother. Thank you.
Any other questions for Ashley? Great. Thank you very much, Ashley, for joining us.
Thank you
I
for
appreciate your time.
Bye.
All right. Any other general questions, comments before we
I mean,
break?
just on the topic, like, I think it would be useful for the record, I know this is hard, and so we may not find people willing, but to get some more documentation of the harm that has occurred to people, and just a little bit more of an understanding of like I think we talked about the Secretary of State's office maybe here, and I know they have spoken, I believe, on this bill already, but like just getting a little more detail about accountability for providers when there is harm caused, avenues for recourse for people. And I think the other thing is just like something I'm leaving today is like with this understanding that it sounds like state law defines a consumer as someone who purchases something, but the reality is that you can consume something without purchasing it. And so that's something I think the legislature needs to think about. I don't know if it's only this committee but I mean, that's what's on my mind.
We're gonna focus on.
No, but it's what I'm saying is that's what's on my mind though, because like it came up today with the Attorney General about this general consumer protection law. That's all. That's my reflections on the stuff.
Thank you. We are having OPR come back in,
Okay.
and we'll work on the other stuff.
Thanks. This is for the parking lot. I know, and I'm not saying we do it now, but just in case there are other people that are interested, I would be interested in looking at state oversight and regulation of pregnancy crisis centers.
So I think the first step is to have OPR come in, right, and talk about what happens today.
Yeah.
And then I just want to remind everyone, we are 6 weeks left in the session. So
That's
to
why I
your
said
point,
it's the parking lot.
It's only so much we're going to be able to do. So it is in the parking lot. Do you have a question?
Oh, I'm in the same parking lot as Mark. And
Right,
because
the parking lot can work this summer, maybe.
yeah,
Okay.
because it's
Exactly.
like it's clearly a service, a healthcare service. So I find it's incredible. Like the testimony we heard today was incredibly difficult to hear, but it's very clear that there are services being provided that are relevant to the work of this committee, relevant to Vermonters, and definitely play a part in healthcare of Vermonters. And I'd like to know more about them.
Yeah, and I think that's an important point to make, right? So we are not, this bill does not say pregnancy centers cannot operate. They are obviously providing care to Vermonters that some Vermonters want and need, right? Our concern is there unethical practices also happening that might be harming other Vermonters, right? We would look the same. We would want to talk to anyone in the healthcare realm around those two issues. So yes, they are providing a service. Anyone else?
Electric Lake, how about you?
Anyone?
I'm going to sit. I'm bringing a lawn chair.
Okay.
Any other questions outside of the parking lot? All right, so this afternoon, we are switching gears because we discovered late last night that our floor is going to be very short today. So we are going to, after the floor, is it after the floor, Claire, or is there a specific time?
After the floor, we're going to.
Okay, so 15 minutes after the floor, so come back and we're going to do a walkthrough of S47, which is an act relating to the transport of individuals requiring psychiatric care. And then we'll have testimony on that for the afternoon as well. And then we'll be back on the floor tomorrow at 9:30.